Thanks, Mike, for joining us. We're here at Nourishing Change. We're at the conference. Introduce yourself a little bit real quick for our audience.
I'm the co-founder and CEO of SiPhox Health. We're a home blood testing company. We make it frictionless and easy to get blood test results at home comprehensively with a painless arm collector patch that replaces a phlebotomy draw. And then we have a suite of AI and services on top of that that help people get healthy.
Thank you. So just in general, like what are you seeing and hearing and talking about day to day with your team these days?
There's over the last, we've been around for about 6.5 years. There's just such a big surge of interest in preventative health and telehealth services and so on. And pretty much the bottleneck for a lot of those things is a blood test, whether it's to get into the program, stay in the program, stay on the drug, get whatever it is. Optimize whatever the hormones are. It's pretty universal. And so, we're just trying to make and sell blood tests, as efficiently as we can. And that's actually in and of itself pretty difficult. But one thing that's been really nice is there's so much progress in AI for analyzing the results that we've really been able to massively increase what we do with the results for people without increasing the cost. So I think it used to take us at the very beginning, it would take us like 2 hours of clinical time sometimes to release a report to somebody. And we have that down, orders of magnitude in most cases. And so that's something that the quality of post blood tests, kind of the results analysis and optimization that people can be offered today versus 5 years ago is a huge change. And that's something that we're just downstream beneficiaries of that, like building in this space.
So what are some of those like more common things that people kind of lead them to this solution to say like, hey, that's the thing that I want to get my blood tested for? Like, is it, I heard thyroid on your panel is one, like what are some of those common reasons?
I think longevity is this area, which is, it's really linked to chronic disease because the chronic disease that everybody has is aging, right? So everyone is aging, right? So in the end, what longevity really is like prevention and avoidance of most people start out healthy, right? So if you start out healthy, what you're really trying to do is prevent, manage, or, forestall chronic disease, which is eventually what, reduces your quality of life. And so we think of it as just a continuum. Like some people come into our product funnel as like somebody who has a chronic disease. They're already being forced to test or they have to test by their, and they just want to do something that fits better into their life. Like it saves them 3 hours every time to not go, or their phlebotomists always miss their veins, like that kind of stuff. And then you have the people who are like, well, I heard all these podcasts about people that are staying healthy into their 70, whatever, like Huberman has 7 girlfriends, and he's 50 and whatever. And like, why isn't this happening to me? And then they kind of go down the rabbit hole of, okay, it turns out you can really, by measuring these things, you can start optimizing your health and making like simple changes that are personalized that actually improve all these things. And, you can live much longer in a way that's like people in the past didn't expect to. Right. I mean, you can even see this, like, it's kind of funny, but even our politicians are just getting older and older, right? And they're still quite functional,
Right.
And I think we're going to see only more of that because that's still the boomers, right? So like once we get into Gen X and so on, I mean, these people are going to be impossible to get rid of.
Seriously.
Eventually.
I hadn't thought of that. Kind of a side effect here that we'll get to deal with, at some point. So we're here at Nourishing Change. I mentioned this conference is really interesting. It's kind of unique from coming from a lot of healthcare conferences that I attend, at least, where prevention isn't just like something that's on the margins here. It's all we're talking about here. So the world you're just describing, where SiPhox is focused, how does that play into this whole trend? It's not just a trend; it's a movement towards prevention, helping in the individual consumer kind of live more proactively with their health. I feel like part of that is, to your point of like just a comfort level with a blood test or knowing how to interpret your results or what to do with it. Like how does the work that you're doing kind of come into play with a lot of the other topics that we're hearing at this conference?
I mean, I think they call it nourishing probably because they're in the end, they're in the business of selling food, right? So it's a lot of these places they're pharmacies, but they're also in the business of selling food like Kroger or whoever. And I think that's a strong admission that a lot of in America at least, a lot of chronic disease comes from food, right? So in the end, like the mix of food and the quality of food and everything that people are consuming is really like one of the major drivers. And so I think it's great that these companies that are selling food actually care about this, right? And I think it's also very forward thinking of them because I think it's better to be on the right side of history with these things, right? So they understand that like, okay, this is probably going to change. It's already changing for a while, right? So people are demanding higher quality food, things that make them healthier, like all these things. But I think it's only going to get more. I think there's like, I don't track this completely, but I think like, stocks of people making like potato chips, that's down because of GLP-1s. And like, I think yesterday, Victoria's Secret stock was up like 40% because people are getting skinnier and just buying more lingerie, right? So I think you just want to be on the right side. I mean, in the end, like it seems like these things are headed in the right direction, and it's good to be on the right side of that, So I'm excited that companies like this are actually thinking this way,
Agreed. And it's not just health or wellness companies anymore. Like you mentioned, these are retail, they're apparel companies, there are all these other brands that at the end of the day are going to be a health or wellness company.
And honestly, this stuff used to be pretty relegated to like a couple of cities on the coast, like LA. Everybody's like cares, whatever, is like drinking spirulina and trying to be like 1% body fat. But I think it's now become pretty universal across America that people are interested in this. So I mean, we're in Iowa, right? So it's I think it's right. Which is great. Like I think, and it's probably a more pragmatic version of this stuff filters through from like the crazier people on the coasts, and can be scaled up in like the rest of the country. So which I think
like
is
a good way to mention it. You're right. Yeah. Like this is not on the fringes anymore, or just like for those who we think can afford it or something. These are you're right. This is a very down to earth version or approach, I guess. Mm-hmm. What can you tell us about what SiPhox is focusing on, or like between now and the end of the year? And I mean, you can't share anything that that's not out there yet, but like what areas are you focused on right now?
I mean, we're really excited about just continuing to grow. So we sell to businesses that deal with consumers and need blood test data. So that's growing very quickly for us. And then we sell directly to consumers, subscriptions for blood testing. So we enable them to, usually it's people that already want a blood test, they just don't want to go in. And so we're enabling people to do that and build it into their life long term. So that continues to grow. But the really big event for us is we're working towards some of our blood testing being done fully at home, which we've been working on for 6.5 years, kind of like an espresso machine device. That's what we started a company around.
Oh, cool.
Today, you have to ship the blood test, like the actual blood that you collect with the patch. You still have to ship that to us by FedEx. So we're hoping next year to launch our first use case where you have a little machine that processes at home, and that'll be for thyroid patients, for some of the most tested patients, because you have to titrate thyroid medication. And there are 26 million thyroid patients in the country. So it could be, a really big game changer. We have a large consumer waiting list of just individuals that want to buy this. So we're working very hard on getting it out on the market.
Fantastic. Yeah, well, it's gonna be a big deal. It's gonna be a big move in the market. I could see after that. I mean, anything that's what we talk about so much on the show is just anything that's driving us to feel like we can engage more because healthcare is either easier, it's more affordable, it's more accessible, or it makes more sense to us, it's more comfortable. Like those are all good things. Like we want to see and hear more of that. To that end, when we talk like to the healthcare industry, the medical industry, the traditional settings that used to be our only way, it felt like to feel better, we had to wait till we got sick, and then you're going to get treated. This is such a shift from that. It's one of the most refreshing things is the fact that that's not the only way to get better now. You don't have to wait till you get sick. Mm-hmm. What's your message like? How do you approach that? You mentioned like, even selling into businesses and things. How do you, I guess, what's your message for the healthcare community, for providers and, the medical side of this? Because, we always try to say like, let's not keep a silo between those conversations and the ones that you're having, for instance.
I mean, I think a lot of like regular healthcare institutions are in like a firefighting mode a lot of the time. And so I don't know how to solve that, to be honest with you, but I think people just have to bet. Like it's very hard. I think there's this whole culture of like, well, how do we really know if this will save money or like things like that? I think at some point there's just now so much evidence that if you just, again, you just go back to GLP-1s, like you can is this really going to save money? You think, yeah, it turns out that if you cure people of this very serious thing they have, which underlies many diseases, now there are studies that are like, you have less cancer in people on GLP-1s, right? So it's just, I think at some point, I'll give you a funny anecdote. So I've been to a lot of conferences that are like full-on healthcare, serious conferences, like mainline, right? And I've also been to some which are like biohacking people. And the biohacking people, like we've had booths next to people that are selling like, I don't know, holy water, like something that's total nonsense. And when we test people at these conferences sometimes, like for their blood work, and the people at the healthcare conferences have terrible blood work compared to the people that are at the woo-woo like wellness conferences.
Wow.
So like the people with the holy water are actually very healthy. It's like, is the holy water making them healthy? Probably not, but they have a belief that it's possible to be healthy. Like I think there's kind of a negative bias in the healthcare industry. It's like, everybody gets sick and so they're not as open to just like, okay, maybe 50% of these things work or 30%, but there's a lot of prevention that works. And you just have to, at some point, I think it's already kind of in the water that, okay, there's maybe 10 years ago, there was more skepticism. I feel like it's already kind of in the water that, okay, we can actually do a lot here. And I think it's only going to get better. So,
Love that. All right, last question for you. So when you're talking to somebody who can benefit from your service and can just benefit from having their testing done as a starting point in their health and wellness, like they're just kind of re-engaging or maybe engaging for the first time, what's your most general advice there? Like what do you share with them to help them be successful on that journey?
I think typically, so it's the opposite of the normal approach in medicine is you test as little as you need based on the symptoms and so on. I think at this point, it's pretty clear that you want to start with a very comprehensive test, and then maybe on a higher frequency, you're doing a test for the things that like maybe are more risky for you, right? Like are more out of range or you have a bigger problem with. So I think we just see so many examples of this because some of our panels are very comprehensive. People are testing, they don't even know what the biomarker is, right? Like it's a consumer. They don't know what, ApoB is or whatever, but if it gets out of range, then they learn about it, right?
Right.
So I think it's, it's a different model. And I think the model in the past is also based on how blood testing was done in the past and insurance reimbursement, all these things. But if you're just looking at purely what benefits the user, it's getting a very big data set at the beginning so that you don't have any, there's no blind spots. And then from there, you can go to like a more frequent test that matters to you or even no testing, right? So it depends. But I think if you've never been measured, it's leaving a lot on the table because just the relative benefit can be so big.
Really appreciate your time, Mike. Thanks for joining us today and giving us a lot to think about.
Okay, awesome. Thank you.
Thank you.